Hello, everyone. Welcome to another TGIF episode of the Anti Pharmacist podcast. I hope that you've had a nice week so far, and I know that you're preparing for the weekend. TGIF, everybody, welcome once again. So, November is Lung Cancer Awareness Month, and it shines the spotlight on lung cancer, the causes of it, how to prevent it, and all of that. Okay. And today I want to talk about one major issue, which is a major cause of lung cancer. You guessed right. I am talking about smoking. Yes, everybody, almost everybody in the world now knows that smoking is a major risk factor in lung cancer. And even statistics shows that smokers have 22 times higher risk of developing lung cancer than non-smokers. So that's brought me to the topic of nicotine addiction and how to break free. That's my topic for today. You see, nicotine is the major substance in tobacco, which is the substance used to make most cigarettes. And it can be smoked as cigarette, it can be snuffed, it can be vaped like in e-cigarettes, okay? It can be chewed even. So there are different ways of taking this substance into the body, but smoking is the most common ones. Like I said, smoking has gone from the early 16th century practice of maybe smoking it in a pot, putting them in those long pipes to rolling them into papers as cigarette, and now has graduated to what we call e-cigarettes. Okay, it's like a vaporized form of the nicotine. Flavors are added and it is dissolved in propylene glycol and put in a kind of tank connected to an electronic device that can be charged even and inhaled. Okay. Some people even put it in hookahs. Do you understand? Hookahs that they used to smoke shisha and all of that. That is the new way now. But all of them still translate to taking in nicotine. Okay. Well, like I said, I'll be majorly focusing on smoking today. How to stop it. So, without further ado, let's get right into it. First, what is addiction? So, addiction is a chronic dysfunction of the brain system which involves reward, motivation, and memory. It's simply an urge to do something or use something which interferes with your normal functioning in other areas of life. You see, when you're addicted to a substance, you have no control over doing it or taking it or using that thing to the point where it could even be harmful to you. Even when you know that this thing can hurt you, you still will not be able to stop using that substance or engaging in that behavior. And this may cause physical harm, it may cause psychological harm. Now, what is nicotine? It is that chemical compound. It is actually an alkaloid that is present in a tobacco plant. The botanical name is Nicotiana tabacum. That's the tobacco. Is the major constituent of this tobacco, which was discovered sometime in the 16th century, okay, by one Parisian man called John Nicot, and that's where nicotine derived its name. This substance is present in this tobacco plant and it is used to produce cigarettes and other forms of smokable substances like cigars, smokeless tobaccos, snuffs, hookah, even e-cigarettes, like I mentioned. Okay, and nicotine has been known to be highly addictive, even comparable to the likes of heroin and cocaine. Now, smoking as an habit is something people consider more social, you know, than a necessity. Let me put it that way. A lot of people start smoking just as a lifestyle because they want to belong, they want to socialize, not because it is something that they actually need. But over time, people now get addicted to it because of the presence of that nicotine in these cigarettes. And it has been found out that most people start smoking in their teenage years. Many people start smoking in their teenage years, both male and female, which they carry into adulthood. at which point a lot of them are already addicted. Some become chain smokers that they can even finish a whole pack of cigarettes in a day, and they do it continuously. Now, smoking as an habit has many disadvantages that I'm sure that a lot of people know about. There have been many awareness created about smoking. Even cigarette packs have that compulsory insignia that says that smokers are liable to die young. But that has never stopped anybody. Apart from that, there's the risk of lung cancer. Lung cancer has been found to occur in over two-thirds of smokers. So I know that people say, yes, they say that smoking causes lung cancer, but even people that do not smoke come down with lung cancer. Yes, we cannot rule out that fact. But the fact still remains, as shown by statistics, that majority of people that have lung cancer, it is because of smoking. And who even knows, the remaining one third or less, the minority that remains, may be due to secondary smoking. Okay, you know, there's such a thing as secondary smoking. Smoking not only affects the smokers, but also affects people around them who are called secondary smokers. You know, inhaling that smoke from somebody's cigarette may also cause health hazards, even to you or people around. Okay, which brings me to the benefits of smoking cessation. When you make the decision to stop smoking, what good are you actually doing to yourself? It can be divided into three these benefits: the social benefits, the health and personal benefits, and environmental benefits. Okay. Number one, the social benefits. If you stop smoking, for example, you know, remember I just talked about secondary smokers. You do not put people around you at risk of contracting any illness, because even secondary smokers, those that inhale smokes from other people, they come down with diseases like type 2 diabetes. It could lead to exacerbation of latent tuberculosis to active ones. It could also affect people with breathing problems like asthma if you smoke around them. It could negatively impact people around you in the sense that when you smoke around children, it could cause them to want to take up such habits. Also, smoking could restrict your movement. You know, there are places that they will put those signs of no smoking. And when you're addicted to smoking, for example, you want to take a drag, have a smoke, you have to excuse yourself, go out of those places to smoke. That is the social aspect of it. Now, the personal benefits of stopping smoking. There are many health hazards that are attributed to smoking. Over 20 types of cancer, including ovarian, colorectal, even throat cancers, cervical cancers, lung cancer, of course, all of them, they are attributed to smoking. Smoking increases the risks of all of this. So if you stop smoking, it reduces your risk of it. You are not in fear of having all these diseases. Smoking has been found to cause brain and mental deterioration. Like I said, smoking is most prevalent in teens and adolescents, and the brain development doesn't stop till about 25 years of age. So, people that smoke have mental issues like attention deficit disorders, memory losses, learning disabilities. So, it also affects the brain because once you smoke, it goes to the brain very fast. Also, a lot of organ damages can occur due to smoking. The primary one being your lungs, right? Because it's the primary receptor of those smokes. Then your heart, your kidney. Because what smoking does primarily is over time it causes buildup of plaques in the blood vessels. These plaques go ahead to block blood vessels and reduces blood circulation to the body. So your organs are less perfused, blood doesn't reach them, and blood is the life of the body. It's what takes nutrients and other substances that are necessary for these organs to function. So your liver doesn't get enough blood, your kidneys do not, your heart, and other vital organs in the body. This leads to apoptosis, necrosis, death of the cells in these organs, leading to failure. This could lead to the cancer I have talked about or shutdown of these organs. So it's not strange for somebody who smokes to come down with kidney diseases, liver diseases, even infertility is caused by smoking. Okay, because it could reduce sperm motility, It could reduce sperm formation, could reduce sperm count in men. It could even cause erectile dysfunction because enough blood does not get to your penis to cause erection. And even in women, okay, it causes hormonal imbalances leading to infertility. All of these are caused by smoking. So if you decide to quit smoking, you get benefits of reversing all this if they're already in motion or not even having to deal with them at all. The money you're spending on buying all these e-cigarettes or these cigarettes, you could use it for better things like feed yourself and your family. And the amount you have to spend on diseases that are caused by smoking would be better used for other beneficial things for yourself or your family. That is on the health and personal aspect. Now to the environmental benefits of quitting smoking. The number one is pollution of the environment. Have you been to places where you just see cigarette butts everywhere? You know how unsightly they can be? Yes, having cigarette butts litter everywhere. If you quit smoking, you will not be a contributor to that, right? That's one. Another thing is smoking could cause fire. I'm sure that the statistics will say it. The number of houses or house fires that have been started by just a single lit cigarette stick. So it could impact the environment adversely. Also, the gases that are released from smoking, the likes of carbon dioxide, nitrous oxide, and methane, they are not good for the environment. They are greenhouse gases which pollute your environment, both indoor and outdoor environments. If you do not contribute to that by smoking, then you are helping the environment. So when we say don't smoke, it's one of the commonest risk factors for all diseases. And when you are taking all your medications, you know that I say it all the time that smoking is not an option because it complicates everything. It causes a lot of issues, which I've mentioned. So, smoking cessation has all of these benefits. You don't have to deal with diseases, you don't have to pollute the environment, people are safe around you, you will not be isolated. It even improves your looks. Have you seen people that smoke? They look haggard, their skin sag, their teeth yellow, their lips black. All of these, you will not experience them. They even come down with some skin diseases, the tips of their fingers black, they have bad breath, psoriasis on their skin. All of this you avoid when you decide to stop smoking. Now that I've talked about benefits of smoking cessation, you might be asking, now that we know why we should stop smoking, how do I do it? Like I said, it is an addiction for most people. You understand? So at this point of addiction, they cannot actually control it anymore. It's something that they want to quit, but they may not know how to. In fact, there was a time in my practice when a patient actually walked in, wanted to buy something entirely different, but he just mentioned it that he's tired. He can't go a day without smoking, that he can't even eat anything without having smoked something. Although he mentioned that he wasn't only talking about cigarettes, he was also talking about other substances. But like I told you, most times these things start from smoking cigarettes. And it's usually maybe peer pressure, wanting to belong. And before you know it, they graduate from smoking to cocaine to heroin and the rest, and marijuana too. But once you make the decision to stop, there are ways to go about it. Like this patient, after he opened up and talked about it, he spoke out of frustration actually. You would know that this is a case of addiction. He didn't really like his lifestyle. He wanted to stop, but he couldn't. Of course, I gave him counsel, I helped him, recommended things that he could use that would be helpful with commitment that he would follow through. Okay. So that brings me to the tips to stop smoking, the step by step tips of how to break free. Of course, the number one is talking to your healthcare provider. When you go to the hospital, talk to your doctor. When you go to the pharmacy, let your pharmacist know this is what I'm dealing with. How do I break free? And please do not be deceived. Do not say that, oh, I don't smoke cigarettes. All I do is just smoke shisha. All I do is just take e-cigarettes. At the end of the day, they still resort to the same thing. if care is not taken. Of course, the nicotine in those substances may be lesser, and of course, they are used as a means to stop cigarette smoking. But it has to be controlled in a controlled manner. If not, you will not get the benefits from it. So the first tip is talking to your healthcare provider, your doctor, your pharmacist. Let them know that okay, you are addicted to nicotine, you are addicted to smoking, and you want to stop. They know how to help you. Okay, there are many ways to help you stop smoking, and they're called nicotine replacement therapy. There are prescription medications as well as non-prescription over-the-counter medications or aids. Okay, there is the nasal spray or inhaler. There are nicotine patches, gums, lozenges, and then the prescription medications like bupropion and varenicline. You see, the idea of nicotine replacement therapy, apart from the prescription medications, is to taper down the dose of nicotine you take daily. So, from smoking cigarettes or many sticks of cigarettes a day, you could go for a nasal spray or inhaler. Of course, it still contains nicotine, but at a lower dose. With time, you start reducing the dose further until you don't have to take nicotine anymore. It's like you're tricking your body to wean it off that nicotine addiction. Okay. Also, the same thing goes for the chewing gums, the lozenges, and the nicotine patches. Also, electronic cigarettes called e-cigarettes have been used as substitute for nicotine in treatment of nicotine addiction. Of course, like I said, on long-term use and on uncontrolled use, they have their effects too. It's what nicotine will do in your body that they will still do because they contain nicotine. But when you work hand in hand with your healthcare provider, they can be very beneficial till you stop smoking. Okay. Number two thing to do in order to stop smoking is avoid triggers. Okay. Like I said, most people start smoking as a social habit because of peer pressure. You know, the kind of people you hang out with that will say, oh, let's have a smoke. Or you know that, okay, these people, they smoke all the time. You can avoid such companies, avoid places where you have to smoke or have anything to do with any tobacco containing product. Okay. Another thing, number three thing is you should delay. If you feel like taking that cigarette, you must fight it. Okay, do not reach for it immediately. You can fight it. Instead of taking it immediately, try to go to places that will make you not be able to smoke, like public smoke free zones. Okay, so that at that point, see how far you can go, test your limits instead of once you're craving it, you going for it. Then, number four step is chew on it. Do something else, give your mouth something else to chew on instead of smoking. That is the idea of the nicotine chewing gum, for example. Or instead of nicotine chewing gum, just something else like a normal gum, sugarless gum, candy. You can even eat fruit. Just munch on something when you have that craving. Then train your mind. Do not have just one. Instead of being tempted to have just one cigarette just to satisfy that craving, don't think that once you have one, you stop. So when your brain is telling you, just take one, try and resist it. Distract yourself. Go to places where you will not even think about it. Number six step is get physical. Do you get distract yourself, distract your body and your brain from tobacco cravings? Do something else. Jog. Have do physical activities. You can decide to jog to work, to go to the gym. You can decide to do woodwork, write in a journal, do something with your hands. Just do chores. You can decide to clean just to distract yourself. Number seven, try relaxation techniques. Okay. Yes, some people smoke to deal with stress, and fighting back against the tobacco craving itself can be stressful. So find ways to relax. You can do deep breathing, muscle relaxation, yoga, massage. You can listen to calming music, do some meditation exercise. Okay, just try those relaxing things so that you can distract yourself from the stress that may be a trigger for your smoking habit. Then call for reinforcement. That's number eight. Seek for help. Talk to your friends, your family members, support group members as well. Talk to your healthcare provider. Pick a phone and call somebody. Oh, I'm craving this thing again. Let them distract you. Let them encourage you. During an addiction, what one needs most is people that can support them to fight it together. You know that you are not the only one facing the addiction. And these days, thank God for technology, there's supports online. You can just reach for your phone, talk to a psychologist, all right, talk to your healthcare provider. That way, you are able to fight it and not give up easily. And lastly, remind yourself of the benefits. I've mentioned a lot of benefits of smoking cessation, how it will make you physically healthy, how it will make you socially healthy, even psychologically healthy, financially healthy as well, how it will help the environment. Think of all these benefits, okay? See them as reasons to stop. It helps you save your money, spares your loved ones from second-hand smoke. It helps you get healthier and feel better. You don't have to be dependent on something. You don't have to live in fear of dying if you don't take it. Once you think of all these benefits, then it could be a motivation for you to stop. Okay, so those are practical tips that you can take to stop smoking. Of course, there are other ways to help you stop smoking apart from nicotine replacement therapy. There are cognitive behavioral therapies. Okay, like I said, you can talk to your psychologist. Those are still under asking for help. And once you are committed to it, once you have that never give up attitude, you'll be able to break free of nicotine addiction. Please bear all of these tips in mind as you fight nicotine addiction. Remember the benefits, most especially, and how good it will be for you and your loved ones to stay nicotine free. I won't deceive you. It will be difficult at first, but with time, your body gets used to it, okay? Because there are things that happen called nicotine withdrawal. You start feeling shaky, agitation, anxiety, and all of that. But if you practice all those tips that I've mentioned, especially avoiding the triggers, relaxation techniques, being around people that will help you with the addiction, then you will definitely overcome it and you will not have to go back to smoking. Okay. According to World Health Organization, tobacco causes 8 million deaths every year. Now, the benefits of quitting smoking are almost immediate. After just 20 minutes of quitting smoking, your heart rate improves. Within 1 to 9 months, coughing and shortness of breath decreases. Within 5 to 15 years, your stroke risk is reduced to that of a non smoker. Within 10 years, your lung cancer death rate is about half that of a smoker. Within 15 years, your risk of heart disease is that of a non smoker. So that is what I have for you today on this episode of Anti-Pharmacist Podcast. I hope that you've been able to gain something from it. Lung cancer is no joke, cancer of any kind at all. So you should try as much as possible to live your life in such a way that you not put yourself at risk of having it. All right. I wish you a very wonderful weekend with loved ones, with family and friends. Till next time, stay healthy and God bless you.